The opinions expressed in the following program do not necessarily reflect those of Invisible Wounds or Wightman. Please be aware that the content of Fireside Chats with Deborah may contain sensitive subjects such as suicide, grief, violence, PTSD, and other mental health conditions. By discussing these subjects, we will decrease stigma, bring awareness, and hope. If you need support, please reach out to trusted contacts, family, friends, call your doctor, or go to the closest emergency department. Call helplines such as Boots on the Ground at 1-833-677-BOOT. We hope this series helps build self-confidence in you. On today's show, Dr. Christina Harrington, registered social worker. Let's talk about anxiety and depression. Fireside Chats with Deborah is sponsored by Leslie Motors of Hairston, Walkerton, and Wingham. Visit lesliemotors.com to learn more.
Leslie Motors Sales Department is open Monday to Friday from 9 a.m. to 6 p.m. and Saturday from 9 a.m. until 4 p.m. Give us a call at 1-877-357-3460 to book an appointment today.
And by South Bruce Flooring and Bernie McGlynn Lumber Limited, a local company bringing beauty to your home, one board at a time. Started in 1964 by Jerry and Mary McGlynn in Wingham to supply lumber to farms, the company has now grown to serve both commercial and residential customers. In 1983, Bernie purchased the company from his father and still owns and operates it with his wife Doreen and their children Lucas, Sheldon, and Sharina. You can visit them yourself in the South Bruce Flooring showroom north of Mildmay. A great selection of hardwood flooring and lumber sourced from Midwestern Ontario, along with byproducts of sawdust, mulch, and wood chips. For more information, go to southbruceflooring.com or call 519-367-3215.
Welcome to Fireside Chats. I'm excited today to be able to introduce to you Dr. Christina Harrington, who is from Hamilton. And Christina, I was wondering if you would begin by providing the viewers a little bit of history about the work that you do and the things that you're passionate about.
Sure. First of all, thanks for having me. It's exciting to be here, so thank you for that. I'm a social worker by background, and so I've been practicing, north of probably 20 years. And have a wide range of experience, starting community mental health, and then was in the hospital system in a trauma emergency room, and then an intensive care unit. And then for the last number of years, have been in private practice, really focusing on my areas of specialty, which is with trauma, bereavement, sudden death, as well as first responder groups. And so, of course, the whole gamut that comes with that: depression, PTSD, anxiety, wide range of issues. Yeah.
Great, thank you. So one of the things I think we should do is just acknowledge the fact that in your private practice, you now have created a organization that employs other, are they social workers? That
Yes,
are working for you?
Yeah, so we have a team of 6 social workers in total. Our company is Social Work Solutions Canada. We've been around for 12 years, I think, if I did the math correct. So growing strong and trying to provide a wide range of services with different specialties.
And so are you doing virtual as well as in person? Are you back to in person, or how's that working for you?
Yeah, definitely back in person, but virtual as well. So we have a number of clients that are all over the province. COVID has certainly expanded opportunities for being able to help people across a broader range. But there's something unique and special about being able to do in person, especially for sort of trauma and grief work. That is my preference.
Right. Yeah. Great, thank you. So today, one of the things that I asked you to speak of for interest, for awareness, for maybe providing some hope and some skills for people who are dealing with anxiety. And it's not just with COVID, right? Because a lot of us have had anxiety that preceded that. So I'll just turn it over to you and let you talk about some anxiety and how to deal with it.
That's a big can of worms. Anxiety, comes from many different perspectives. I think at its root, anxiety really is the body's way of telling us that there's a threat or a perceived threat. So anxiety is actually a good thing. We want to have it to a certain degree because that's what keeps us safe, right? If you're camping and you step outside your trailer and there's a bear standing there, you want to feel anxiety and be moving in the other direction. The problem is, if we've had too many stressful experiences or traumatic experiences, the parts of the brain that are in charge of that response kind of get hijacked. And then we have anxiety that kind of gets generalized and people start to experience it more frequently. And so it can take many different forms as well. We're seeing, and you're right, not just COVID related. I think COVID kind of upped the threshold because everybody's brains were trying to figure out just what is the objective threat here. So that baseline, I think, was a little bit higher. But for sure, we're seeing it across the spectrum, right? So small children, anxiety about going to school, young adults. I see a lot of women in their, this is unrelated to sort of stress or trauma, but a lot of women in their midlife, when our bodies are changing, they present with anxiety as well. So there's so many factors that can lead to that.
So the thing is, we're using this term anxiety. And I think anxiety can be experienced and perceived in different ways, depending on the individual. So are you willing to kind of break it down a little bit so that a person might be able to identify, oh, this is possibly anxiety?
Yeah, for sure. So I guess starting with the physiological response, right? So the body's response, anxiety shows up differently for different people. So I think you're right, it can be confusing. Some people have very significant symptoms and it feels, like they're having a heart attack, for instance. Often when I'm working with people, one of our first jobs is to figure out what does anxiety look like for you in the body, right? So do you feel flushed? Do you feel like your heart's racing? Some people feel nauseous even to the point of vomiting. Some people have chest pain right through to the back. And so some people have like a creepy crawly sensation up their arms. And so it looks different for different people. I'd say fairly consistently, because it's part of the body's hardwired response, people will have a more short and shallow breath. So it's kind of that trying to catch your breath sort of response as well. And then the heart beating faster, again, because your body, or at least that part of the brain, which isn't our smartest part, is perceiving a threat, right? So it's gearing up for that. Yeah.
So you've described basically how the body might react if somebody's having periods of anxiety. And you talk about the brain, but maybe what's some thought patterns that individuals might be having, like
yep, no, for sure.
swirling around in the brain?
Absolutely, and that looks different for different people as well, right? But a great kind of analogy, and it's not mine, but one that I love to use is, we all have a range of thoughts. We all have what we call automatic thoughts, those things that just pop into our head, right? Generally, they're not logical, right? They're just there, and they can take lots of different forms. And so one of the examples I often use to help people understand this concept is, if I were to say to you, Deborah, if you were laying in your bed at night and you heard a bump downstairs, if your automatic thought, the first one that jumped into your head, was somebody's breaking into my house, how are you going to feel?
Yeah, I would fear.
Yeah, you'd be afraid, right?
Absolutely.
And your body would respond in a particular way, and then you'd have a behavioral response to that, right? Usually that sort of, fight, I'm ready to take them on, freeze, I feel a little bit paralyzed, or like I'm ready to run away, right? We call that the flight. So same scenario, you hear the bump downstairs, but you assume something's just fallen over. So the automatic thought isn't somebody's breaking in, it's something's fallen over. How are you going to feel in that scenario?
Damn it, wonder what that is.
A little bit maybe more neutral, right? Maybe annoyed, but it's not going to set off the same body response and the same behavioral response. So the way that we think about things, or those automatic thoughts, can very much determine how we respond, right? And so in that case, somebody's breaking in, we would call that a catastrophic thought, right? So we're sort of jumping to this conclusion that something terrible is going to happen. So there's lots of these thinking traps or distorted thoughts. There's lots of different language for it that then drive our emotions. And then the stronger the negative emotion, the more it drives these unhelpful thoughts. And so we get caught in this vicious spiral. Yeah.
Interesting. So if you have somebody who comes and they present and is being anxious, what type of recommendations do you make for them?
Yeah, so generally a little bit of education, so kind of helping people understand, like as we are here right now, where this is coming from and that it's actually a natural response. We just want to rein it in a little bit for them. I generally would start with the body. So again, how do I know I'm starting to feel this? Because the sooner we can intervene, whether it's with those thought patterns or with our physical response, the better result we're going to have. And then generally, in even the first, I don't usually let people leave the first session without giving them some strategies to calm the body. So the way that way our body works with anxiety, it's kind of a two-way street, right? So we can work on the thoughts to help calm down the body, but we can also calm down the body to help calm down the thoughts. So it's kind of, they sort of think of a two-way highway. And so I would give them a number of breathing techniques, would be usually where I start, because we know that when people are having that anxious response, as I already said, they breathe short and shallow. And so when you're breathing in that pattern and with all of these muscles, what tends to happen is it's like all systems go, right? So your body and brain start pumping out all of those stress hormones. And because the part of the brain that's in charge of this is it's an ancient part of the brain, and it's not as smart. It's not sort of our what we call a smart brain, right? The last to develop. If you breathe in a different pattern, we have a hardwired response to move our body from the fight-flight response to our rest and digest response.
Okay. An example of that?
Yeah, for sure. I can give you a strategy. So the first thing you want to do, and there's a million versions of this, so sometimes it's called box breathing, all kinds of stuff. For me, it comes down to two principles: your diaphragm and a slow exhale. So usually when I ask people, so if I said to you, Deborah, take a deep breath, right? Generally what I would get is, which is lung, right? It's all lung. So we really want, and I'll just slide forward here so you can see, we want our diaphragm, which is under kind of our rib cage here, right? So we want that to distend. So you want that big breath in, so your stomach distends. And then if you can hold it at the top if you like, but the second key is that slow and controlled exhale, up to 15 seconds if you can. I don't think I can get quite that far, but. That's as far as I can get. But the key is the diaphragm,
right?
And the slow exhale sends the opposite signal to the brain that our body needs to relax. And so it can be a really effective strategy for just bringing things back down. As I said before, earlier in the chain, so if you know that my first sign of anxiety is, a knot in your stomach, if you use it then versus, say, sort of further down that continuum when you're really ramped up, it's obviously going to be more effective.
So would you suggest that someone practice it on a regular basis in order to really develop the skill, or is it like something that they would then just know about and pull out? Like, how do you see that working?
I definitely have people practice it because it's a muscle that we don't tend to use. I mean, unless you are maybe a singer, right, where the focus is very much on your diaphragm, we tend to lose that somewhere along the line. If you think of a baby, they breathe this way naturally. Like you see their stomach rise and fall. So I would normally have people definitely practice it, even when they're calm. So you feel like you have a sense of what the skill is. I would say it's easier to figure out if you're lying down. So I will often say to people, at night, lay on your bed, put something on your stomach. So if you can see it rise and fall, that's helpful. For kids, sometimes we have them blow out the birthday candle. So taking that big breath and blow out all the birthday candles as slow as you can.
I know some adults would like to do that too.
Yeah, because these skills apply right across the lifespan. And I often, if you think about if you even practice this in the morning, did a couple of these breaths, calm your body down, your baseline, I'm making up these numbers, but if you're running around in the morning trying to get everybody out the door, and so your baseline stress is maybe a 2 or 3, right? And so then everything during your day is going to build from there, right? So even if you start your day with some of these breaths and calm your body, you're starting from a lower point. And
Any other suggestions that you might have besides the breathing to deal with anxiety?
Yeah, for sure. I mean, we have, there's many strategies. So some of the research is showing, so obviously exercise, we know that exercise has great benefits for lots of range of mental health issues. It's showing, and I mean, it's good at any time of day, but particularly for anxiety, exercise, walking briskly earlier in the morning tends to have better results that carry you throughout the day. Again, if you can only get it in the afternoon, don't not do it, right? But definitely there's a benefit there.
Do you know why that is? Is it the same thing, that it lowers the amount of anxiety that you may have? Gives you a better...
Yeah, that would be my guess, right? You're starting from a lower baseline point. I'm sure there may be more to it, but yeah. So, I mean, certainly those work, the breathing. I have a number of other kind of techniques that help calm. I can go through those with you as well. So that's sort of targeting all the body-based stuff. And then there's stuff we can do for the thoughts as well. So I'm not sure what you would like me to expand on first. I have a whole tool chest of things that I'm happy to share.
Well, it is your profession, so people could come to you and if they actually feel the need for it. But I'm just wondering...
I can show you a couple of other sort of quick and dirty tricks that I like to give people, because I find everybody has to, you have to play with it a bit to see what works best for you, right?
Yeah.
So another one that I like, and I've seen it done 2 ways, with the nose plugged and without. And so it's referred to as the Valsalva maneuver. So EMS uses this a lot when you're tachycardic. So generally when we're in stress response.
Can I just ask you, I didn't quite understand what you were saying there.
Yeah, so there's a maneuver called the Valsalva maneuver, so that if you were picked up by by EMS, so ambulance, right? They often will use this technique to bring down your heart rate.
Oh, okay.
Right? So tachycardia, and so when we are in our stress response, our heart tends to be beating faster and our blood pressure is up. Right. So a lot of these techniques try to reverse those processes. So this maneuver, and again, I've seen it done with nose plugged and without, so any EMS colleagues out there can feel free to correct me on this. But essentially you're creating tension in your abdomen again, so almost like you're bearing down, so going to the bathroom, or women who've had babies will know what bearing down means. And you can do this, you kind of, and a slow exhale. Drops heart rate, drops blood pressure. We can also trick ourselves with something called the dive response. So if you were to fall through the ice, your heart rate would lower, your blood pressure would lower, because your body's trying to save itself, right? So we can trick ourselves by putting our face in ice water. Or sometimes I'll have people put ice on their neck, hold onto ice cubes, hop in a freezing cold shower, which I know sounds horribly unpleasant, but they're all things that can kind of help bring us out of that panic response. Yeah.
Great. Now, I think one thing that some people might benefit from is knowing that if they're having anxiety, then it's not a lifetime kind of sentence, that it could be precipitated by certain factors. So, for example, what would you attribute that to?
Yeah. It could be lots of things. So whenever I'm working with people, I mean, obviously we're looking at the mental health aspect of it. But I mean, our head isn't separate from the rest of our body, right? So I always encourage people to look at other factors too, right? So for instance, if your vitamin D is low or your B vitamins are low, that causes low mood, it causes anxiety, it causes all kinds of issues, right? So looking at kind of a number of different physiological factors that could be going on for you as well. as I said before, so I have a lot of women that come to me in, their 40s, early 50s, with anxiety for the first time, and they don't really know where it's coming from. And, it could be our environments, right? That's sort of your sandwich generation. So you're still dealing with kids, but you're maybe dealing with aging parents. So there's all these stressors. It can be hormones as well. So often during that phase of life, our progesterone levels are dropping, which is our nature's value. And so one of the consequences of that is we tend to feel anxious. So that I think it is multifactorial. I mean, you need to look at things from lots of different directions.
Because I know that there are some people that are going through, say moving, right? And just that whole transition into relocating and leaving friends and how do you make new ones, separations, of course, divorce, that type of thing. Having kids that are identified and struggling within the school system. So lots of external things, which my hope would be temporary, not instantaneously resolved, but that type of thing.
Yeah, I think any time that there's a big transition or things that feel uncertain and out of control, right, are kind of key pieces that can precipitate this sense of anxiety, right? I would say generally most people like to have their world fairly predictable. They like to know what's happening from day to day. And when there's all this uncertainty that we can't plan for or manage, it does create this sense of anxiety, right?
So is there anything that a partner or a spouse, friend would be able to do to support somebody when they're having an anxiety attack?
Yeah. First, you have to be willing to receive that external cue, right? I think often, and I often enlist partners or friends, because sometimes when we're in that anxious response, it's hard to remember to actually use the tools that we have, right? Like the communication around, all these tools that we have, and the automatic parts of our brain that are trying to protect us shuts down. And so it's great to have all these tools, but if you never remember to use them, it's not very helpful. And I hear that all the time. They're like, oh, this breathing is great, except it didn't help me in the middle of my panic attack because I forgot to use it.
Yeah.
And so certainly I think often the people around us and that know us well can see us ramping up, right? So if the person is open to it, being able to receive those external cues to say, hey, I think, do you need to take a minute? Do you need to go get some breath of fresh air? Right. I have had lots of scenarios where people are panicking where, I kind of, and again, this is sort of, is it safe to have comfortable touch, right? But to come up to you and kind of put my hands on you and, be like, okay, Deborah, look at me, follow me, look at my eyes, and follow my breath. Let's do this together. And then walk them through the breathing. So I've had to do that lots of times where you're quite literally guiding the person. Yeah.
Huh. Yeah, and I think that's great, and I think it would give that unification or like a solid foundation or between partners and friendships and things like that. It involves a lot of trust and
Yeah, especially when you're kind of feeling so very vulnerable, right? When we think about things like social anxiety, there's a lot of embarrassment and shame and worry about judgment around that. So people try to go to great lengths to hide the distress that they're having, which actually creates more distress because then you're really focused on can people tell, can people see, they're going to judge me, they're going to think I'm crazy.
Yeah, sad in some ways, yeah. If we could move on. Absolutely. Not that this isn't really interesting, but you could go on for quite a period of time, or we could on that. But also had asked you to talk about depression. It can, I think, go along with anxiety, but it can also be a separate issue that people are dealing with, I believe, so.
Yeah, so often, you're right, many of these things co-occur, right? For instance, with post-traumatic stress disorder, 80% of people will have depression as well, right? Depression can occur on its own in a number of different forms, right? So it can be quite severe, it can be more mild, it can cycle. So with our bipolar affective disorder, where people have, highs, generally followed by very significant lows. So there's quite a range of things. I mean, we can also have complicated grief, right? Where it can be difficult to determine when is this clinical depression, when is this normative grief. And so, I mean, there are a number of things we look for, right, when we're assessing for depression. And just to say, so at least in Ontario, social workers don't diagnose, but when you deal with this every day, you have a good understanding of what you're looking for. Yeah.
Okay. And you talked about some of the situations that people go through. I'll do like a disclosure. When my husband died, there was 3 months where I felt like I was just totally out of it and thought I was going crazy. Psychiatrist said, no, this is normal grief. And the depth of it, like, I mean, I know what it was like for me, and everybody's journey is different, but can you maybe tell the viewers some of the things that you hear without, of course, disclosing confidentiality issues?
Around grief?
Well, around depression, depression/grief.
Yeah. So I'll break it up a little bit. So certainly, I mean, when people are coming with depression, so aside from grief, often describing persistent low mood, or just irritability, like in snappy, it kind of presents differently for different people. No motivation, like hard to kind of get moving in the morning, hard to set goals, probably changes like they're either eating a lot or they're not eating very much at all. Usually sleep is either disrupted or they're sleeping all the time. Sometimes suicidal ideation as well, feeling, whether that's kind of passive, feeling like it would just be easier if I just didn't wake up one morning, or whether people are having those active kind of planning sort of thoughts. So again, we're looking for a range of things. With grief, when people come to me, usually in the first few months, we have our eye on it, we're watching it, and it's an open part of the conversation. But I mean, to bereaved, the ancient origins of the word literally mean to be ripped apart, right? Like, this is a normative response for everything in your being to cry out against what's just happened. And so we're looking again for that prolonged, right? That not moving forward, and maybe some other kind of concerning behavioral patterns. Because depression is such a range, kind of most of the research shows that a combination sometimes of, and this would be more moderate to severe, a combination of therapy, right? So working on those thought patterns, as well as some other things, or any underlying traumas. So a combination of that and medication is sometimes needed. So often the conversation that I'm having ongoing with people is about where they're at, and if we're getting stuck, sometimes we need to look at it when we're in that more severe range. Is the chemistry in our bodies so off that it's hard for us to utilize the therapy tools, if that makes sense?
So would you recommend somebody go for like a medical assessment, some blood work to see what their what their levels are, their hormone levels and vitamins and that?
Yeah, I generally do. I mean, that's just my practice to say, have you had recent blood work? We need to sort of look at everything, right? A lot of family physicians right off the hop won't necessarily, or not even just family physicians, hormones are not often a starting point for some of this stuff. I think that's just the way we've approached these issues historically. Maybe that will change in the future, but certainly there are some key things that we know have parallels, right? Like as I mentioned, like low levels of vitamin D. If you are primarily vegetarian, right, B levels can be really low as well, and those all affect mood and cognition. In our first responders, working shift work, where there's lots of research to show, and most of it being done on men, but that testosterone levels tend to be low, and if your testosterone levels are low, then your mood is low, generally speaking. So for sure, if I'm hearing some of these key indicators, I would ask that somebody maybe consider having that conversation with their family physician as well. Just kind of tackling things from, doesn't mean we don't do the therapy, but it's kind of looking at things from every angle. Global
kind of assessment. Yeah. So if you have somebody that comes in with a list of symptoms of depression, and you can't diagnose. So once again, they need to go back into the medical model, see their doctor in order to have blood work done and maybe any medications. So, do you tend to have does it work in your experience that there's a good connection with doctors, or is it sometimes problematic?
I think sometimes it varies. I think doctors are often overloaded, right, and carrying high caseloads, and we have a shortage of doctors. But generally, I would say that most doctors are very open and responsive, and so it's because you're supporting them to support their patient, right? And so I can't say that this is everybody's practice, but certainly it's mine that when I'm seeing these things, I will fill out some indicators, have people take it to their doctor. I will have, or I'll make those phone calls, and again, obviously with their consent, but and open up those conversations so that that dialogue is going, so that I can easily then say to the physician, you know, I mean, sometimes I'll see an increase in symptoms when people are changing meds, right? So to be able to go, I have some concerns here. These symptoms are getting worse, not better. To have that open dialogue is really helpful.
Oh yeah, and then you can do early intervention.
Yeah. I think there's a lot of, in our healthcare, the way it's set up is a lot of working in silos, right? And so as much as we can kind of bridge those gaps is helpful.
For sure, yeah. Good point. That could be a whole other discussion. But okay, so if we're talking about depression and we acknowledge that some of it's very normative because of life stressors or life situations, and that the counseling can be just a means of support and teaching of skills and normalizing the process so that you move through it. Some people, unfortunately, don't move through it.
Right. Absolutely.
And then we're having people with suicidal ideation.
Absolutely, yeah.
And I know that myself, I have lost some individuals that I have worked with, and that is very difficult. I mean, it's a fact of life. You can't prevent everybody. So do you see the rates are climbing in your own profession? Like, do you think the stats are going up?
Yeah, so okay, a few pieces there. So just one general comment. You know, I was looking at some statistics before coming on today, and the one that really struck me was that by the age of 40, 50% of the population will have had or has a mental health issue. So that to me was staggering, especially when you think that a lot of these statistics are from StatsCan, so they're always a few years behind. So that doesn't even look at what's happened during the pandemic, where for sure we've seen, for a large variety of reasons, mental health issues escalate. You know, McMaster, there was an article a while ago from McMaster Hospital. Their rates had tripled of youths presenting and being admitted with suicidal attempts and intent. So the numbers are definitely going up. It's really impacting our youth as well. So yeah, for sure, I would agree with you. There's a marked change there. When we're dealing with suicide, there's a lot of culminating factors that really bring somebody to that place.
Yeah. I just, I wonder in part if personally, I worked in the medical system for my whole life, right? And so the medical model, I understand its purpose, I understand its existence, and, you know, compliment the people who work within it. And yet at the same point in time, that whole thing about identifying symptoms as mental illness, being, having that stigma and that negative attachment, I don't think it's really beneficial, and I personally wish it could change. Instead of mental illness, just to normalize it, because people go through various situations, and I don't know, like my belief is that instead of saying, you know, this is a normal reaction to an abnormal situation, which is tendency to what we use, right, in the system, and that is that we just validate this is a normal reaction to a normal situation, because this is kind of what life can bring to you. What's your thoughts on that?
Yeah, I agree. I mean, I think it goes back to that statistic, right? If at least half the population at any given time is experiencing strong reactions to difficult life events, yeah, we really do need to normalize that. And certainly, I mean, that's the language I use in my practice, right? So I can get a bit geeky. I love the neuroscience, but I love to be able to explain it to, in my limited understanding of it, because I find that's often validated for people. Like, no, this is actually the way we're designed to respond. So you're not crazy. Your body's doing what it's actually supposed to do.
Right. No, good. I'm not the only one that thinks this way. A little bit. Yeah.
Yeah, and certainly, I mean, far too much stigma around not just mental health in general, but even, you know, specific different diagnoses, right? Or suicide, like as you said, yeah.
Well, even, for example, when you spoke about bipolar, and this is one of the things I hear repeatedly, is that a person who's been diagnosed with bipolar has mood swings. They go up and they go down, they go up and they go down. That's not necessarily the truth.
Yeah.
You know, some people who are diagnosed really have PTSD and have been misdiagnosed, right? In my opinion. And then, so they don't have those fluctuations, but they have that label, which will follow them for the rest of their life because it's been charted someplace.
Yeah, and I think so many, I think so many of the diagnostic criteria across things overlap, right? And so sometimes I think it does get very muddy, or it gets complicated to figure out. Or again, there's the silos. So I've done a considerable amount of work with head injury. Well, if you have a frontal lobe head injury, your symptoms overlap and look very similar to somebody who has PTSD or an acute stress reaction of some other kind.
Right. Yeah. Yeah. So for that, if we're talking about stigma, how do you see us? I mean, you know that, you know, that I personally am invisible and passionate about working with first responders in kind of preventative way, or increasing awareness by doing the seminars and conferences and that kind of thing. And that's like a little drop of water in a big lake. What other things do you think might help, not just with first responders, but with the general public?
Around stigma, you mean?
Around stigma.
I think just lots of conversation, right? Lots of normalizing. I think if there's anything maybe positive that has come out of the pandemic is so many people are accessing services. The conversations have really increased. Organizations have upped their plans in terms of what's available to their employees. So I think if that's a positive shift in the sense that there's more acknowledgement that this, again, is a normative reaction to really difficult life events, and the supports need to be there for that.
Okay, thank you. And in closing, we've talked about anxiety, we've talked about depression, we've talked about the services that you are able to offer through your organization, and we acknowledge that there's other organizations out there that are working hard at doing a good job and available for folks. Anything else that you'd like to say in closing?
I think that, if you're looking for services, don't be afraid to interview a few, make sure that the fit is good, because it really comes down to relationship, right? So you have to be comfortable with the person that you're working with and the supports that you're receiving. Don't be afraid to ask questions. And somebody that has sort of a breadth of knowledge in whatever it is that you are coming forward with, right? So if it's issues in your relationship, somebody who has some training and background in that. If it's trauma, somebody who knows how to manage that piece and treat it. And sometimes people need to see different service providers for different things, and I think that's okay too, right? It's really, what is the comprehensive plan that's going to support you in the best way?
Right. Just going with that a little bit further, can you acknowledge or identify some of the different modalities? And we use that term modalities. Mm-hmm. People in the general public might not even understand what that means. So if a person goes to counseling, takes that big step and picks up the phone and asks for an appointment, what might they receive depending on who's doing the counseling?
There's a large breadth of things there, which I think probably actually makes it hard for people to figure out, what do I need, right? So I mean, the example that I gave earlier, right, about that thinking model, I mean, that would be a cognitive behavioral therapy example, right, helping us draw connections between our thoughts, our behaviors, and our physical reactions, those things. There's acceptance and commitment therapy, which really looks at core values. There's DBT, so dialectic behavioral therapy, which is really focuses strongly on regulating our strong emotions and giving us skills to kind of calm and self-soothe. There's mindfulness and meditative practices. There's specific trauma modalities. So if you're looking to address something in particular that's happened. There's interpersonal. There's so many modalities out there for sure. Yeah.
And I think one of the things that's very interesting is I'm hearing more about use of therapy dogs and equine therapy and that type of thing, which is it's whatever works, right?
Yeah, or the creative therapies, right? So there's music therapy, there's art therapies. It's not a one size fits all, and I think sometimes that's a caution, is that we can't kind of force people into a cookie cutter approach. And different therapists will. So some therapists really prefer a model, but they'll be hopefully quite transparent about, this is the model that I use, right? My practice has been more eclectic, so I feel like I have a range of therapies that I draw from depending on what's in front of me. But again, I mean, sometimes those are good questions to ask right out of the gate. What is your approach?
All right. Well, thank you. And with that, I think we'll wind it up for today. And thank you very much for joining us. And we'll see you next week.
Thank you.
Thanks, Christina.
Thank you for sharing your story on today's show. Now we'll hear from a few more people sharing their own resiliency and truth through the Simcoe County Suicide Awareness Council's 11-second challenge videos.
Hello, I'm Deborah MacDonald, and I'm doing week number 5 of the 11-second challenge for Simcoe County Suicide Awareness Council. And I've been thinking about it and wondering what I could say that would be helpful to provide hope. And I think that by telling the truth, that's the best I can do. So the truth is that I was suicidal at one point in my life. The truth is that I was hospitalized for 2 weeks, preceding getting a diagnosis of post-traumatic stress disorder. And so I was put on some meds to stabilize me. And that started my journey of recovery. And I want you to know that it was challenging at one point in time, finding a counselor who kind of fit with my personality, so I had to shop around, and that was something that was difficult, but I had lots of support from individuals that I'd met who had also had trauma in their history. So yeah, it's been quite a ride sometimes, but and like, as I say, it can be challenging, but it also can be very rewarding. It can be filled with love, it can be filled with enjoyment. So if you got any thoughts about suicide, please reach out. Let's break through the stigma, gain some awareness, call Boots on the Ground. They're there 24/7. Find yourself a counselor, get some help, because you're worth it and you deserve it. Okay? Thank you. I'm Deborah MacDonald from Invisible Wounds, and I'm here with my friend and a volunteer, Paula Turner, and we're here to spend a few minutes responding to the 11-second challenge that's put forth by Simcoe Suicide Awareness Council. So, Paula, you have a few things to share.
Yes, welcome to 2022, and thank you, Deborah, for coming over. We noticed as we were talking, my uncle had given me this wonderful plaque for Christmas one year, and I thought it would be nice to just take a couple seconds to go through what was written on it. Laid it out pretty good. Take care of each other, be kind with your words, be mindful of what is going on in other people's worlds right now, because it might not be the same as what's going on in yours. Don't hold grudges, laugh every day, be yourself, have a sense of humor, take responsibility, have character, embrace your differences, learn from mistakes, hug a lot. I know that's hard in these times, but that's one of my favorite things. Human contact does a certain amount of good for your body. Respect each other, be grateful, show compassion, but above all, love each other, because there is no place like home. So thank you for giving me this 11-second challenge, and hopefully people know, like, be aware, and if you need someone to have a conversation with, we're always there. Have a conversation. Just look us up.
Pick up the phone, okay, and call.
Thank you.
My name is Deborah MacDonald. I'm here with my daughter, Christy.
Hello.
And what we'd like to do is let you know that what we're doing today is the 11-second challenge that's put on by Simcoe County Suicide Awareness Council. And so today what we're doing is just showing that acts of kindness can be done within a family. We're working together to prepare Christmas breakfast and to share it with a limited number of people because of COVID. So our best wishes to you for Merry Christmas if you celebrate, or Happy Holidays.
Merry Christmas.
Merry Christmas. Hello, I'm Deborah MacDonald. I'm here with Crystal Belmore from Brown's Farmer Save in Wingham, and we're doing week 2 of the Suicide Awareness 11-second challenge put on by South Simcoe County Suicide Awareness Council. So, Crystal, is there something that you would like to say to the audience?
Well, I'd like to take time to say thank you for coming in. And this means a great deal to everyone, because we all, during these challenging times, need to have a talk with someone. It doesn't matter who it is. Old, young, doesn't matter. But remember, we are all out there. We are all struggling. But we all need one another. So during Christmas, how about we reach out to anyone, loved ones, an elderly person, someone who doesn't have anyone, and take them a coffee or a tea or a hot chocolate and have a chat with them. Everyone needs to have a chat. So from Brown's Pharma Save, I'm wishing you all a very Merry Christmas and an excellent 2022.
Hello, my name is Scott Mills, and I've been involved in the 11-second challenge led by the Simcoe County Suicide Awareness Council for a little while now, and they're doing great work. And the idea is to share a video about what you can do to prevent suicide. So my theme is taking care of yourself. So stupid little things like I just walked out and sat on my porch because it's a beautiful sunny day, and I can feel the nice crisp air out here, and it just invigorates me. And another thing is, I go to the grocery store sometimes, and you know, you're always looking for bargains and stuff like that. Just go to a really like fancy grocery store and buy some really nice food that I like to eat. You know, really, really high quality vegetables. I love steaks, a really good steak, and treat myself, even if nobody's around. Another big thing is try and make your bed. When you first get up in the morning, it kind of gives you a sense of control over things are tidy and things are neat, and I can move forward with my day. And always check in with people and have general chats. Just be normal. And I guess those are my tips. And thanks, everyone. Thanks to Deborah MacDonald for making me do this video. Your enthusiasm is catchy, and that's what it's all about, just keeping connected with people. And thanks to all the fine people at the Simcoe County Suicide Awareness Council for their great work with this 11-second challenge. The idea is to stop suicides. In 11 seconds you can do that. And there's like 11 people per day in Canada that die by suicide. So they want to change the narrative. 11-second challenge. Check it out on social media. #11-second challenge.
Hi, I'm Debbie from Sweets and Treats in Mingham. Thank you, Deborah, for asking me to do this challenge. It's very important that we all are kind to everybody. Everybody is struggling, especially at this time. And it doesn't hurt or cost anything to reach out and touch somebody with your kindness. So please think of everyone else and yourself, of course, too, and just be kind. Thank you.
To all the people who are suffering out there and need help, you need to believe in yourself and understand that you are so valuable and so important for this planet. Don't make anything make you feel that you are not important or you're not worth anything. You are worth everything on this planet, and everybody needs you on this earth. Don't be discouraged. We just love you and we're here for you with anything you need.
Good morning, I'm Deborah MacDonald and I'm here with Diane Foxton, and we are together going to assist and promote the 11-second challenge that's been put forth to us. So, Diane, I believe that you have something for me. The challenge actually is to assist with awareness about suicide, death by suicide, and to promote prevention of same.
So kindness is something that just isn't exercised this time of year. It's something we've got to keep in mind for 365 days of the year, 24/7. I haven't seen Deb in quite some time, and I was pleased to see her today, and I'd like to offer her some freshly baked shortbread cookies.
Yay!
Enjoy, Deborah.
Thank you very much.
Merry Christmas.
Thank you.
Invisible Wounds will host events promoting mental wellness to first responders, their families, and civilians. Our upcoming national conference, the Invisible Wounds Conference for First Responders, will be held October 5th and 6th, 2022 at the Prince of Wales Hotel and Spa, Niagara-on-the-Lake. To find out more, please visit our website at invisible-wounds.ca.